Believe it until I hear it out of our next guest's mouth. Ann Compton with ABC News White House correspondent. Good morning, Ann Compton.
And good morning. What is it you'd like me to say?
I want you to tell me if the Healthcare.gov website is actually working like the White House says it is.
Well, there are a lot of people getting on, and it's not crashing. The daily briefing that they give us suggests that 1 million people got on Monday. Now, not all of them bought insurance. I was one of the ones on Monday, but about 18,000 people by the end of the day, I believe, had actually purchased insurance. There are some problems, and they admit these, but they're pretty vague on what's going on. If you go on, you go through all the process, you pick your plan, you put in all your information, you walk away saying, I just bought insurance. Some insurance companies are saying they're not getting the details. When the actual application arrives, it may be garbled, it may be incomplete, it may not arrive at all. The White House actually yesterday cautioned Americans to call your insurance company and make sure that insurance is going to go into effect, which is not an encouraging sign. That said, President Obama yesterday told a kind of a pep rally on healthcare insurance, on the Affordable Care Act, that no one in Congress is going to repeal this while he is still president.
All right, a couple of questions here. Is there any talk of them pushing back the deadline for people to have insurance?
Here are the two deadlines that have already moved. Early on, the president said big corporations, which already supply insurance to their customers, he's giving them an extra year to realign their plans, and so 2015 will be the big year for them. He just over this last weekend gave small businesses another year. Somebody who employs maybe 5 or 6 people, wants to provide health insurance, but is having trouble coming up with all the answers that they were supposed to be able to use the website. So small business now has an extra year. What he will not move, at least what they continue to tell us every day, is March 31st. That is the day in which individuals who have no insurance, that's maybe as much as 20% of the country, people who have no insurance at all, have to buy insurance by March 31st, or the IRS will take a penalty fee out of their taxes.
Do we, as the administration, saying how long it'll take before this latest glitch is finished, where we have to call the insurance company to make sure we actually got insurance?
They do not. And you know what else is a bit of a problem? They built the website from the front to the back. The front of the pipeline is where people go in to window shop. You can now window shop for plans in your specific area. You can fill out the application. You can actually enroll. It's the glitch to get your information to the insurance companies, and they are still apparently building the part of the website where you put your money down, because you're not paying the federal government. You are paying a specific company. And that's something that insurance companies do all the time. They have been in the business of taking your money online. The government in the middle of it is what makes it a little different.
Here's my question, Ann Compton. We kind of touched on it last time we talked about this. If I go online like I've done and I compare the plans and I pick out a plan I want, can I call the insurance company direct and say, I just want to buy it directly through you?
You know, my guess is that you can. Here's the hang-up. If a low-income family, which is struggling, has very expensive insurance now, finds a plan they like better, and the federal government will give them money to help pay for that premium, they can't go directly to the insurance company. If you're going to pay the premium yourself, go right ahead.
That's an excellent point. What about this story that came out yesterday where they're saying that the Affordable Care Act is actually costing billions of dollars less than they first thought?
Well, put me down in the skeptics line on this, and here's why. The estimates of how much people are paying in premiums and how much the system will be paying out in actual medical claims is all based on estimates. And when you get estimates from a budget office and a the Congressional Budget Office and other kind of Office of Management and Budget estimates, I'm not sure I believe they are really built on a firm foundation of hard fact. I think the real costs will not be known until this is in effect for at least a year.
And Compton at the White House, last question for you. Any Democrats wavering, any Democrats jumping off the Affordable Care Act ship that you've heard of or from?
Well, there have been people on the fence, and where they are the most vulnerable, there are a lot of Democrats. Of course, obviously in the House of Representatives, everyone is up for re-election in 2014. In the Senate, there are a lot of vulnerable Democrats. I can think of a couple of states like Louisiana, where a Democratic senator she's in real trouble with some of her constituents if she embraces Obamacare without any kind of moderation, without any kind of amendments or qualifiers. So there are some Democrats, especially in the House, who are worried about getting home at Christmas and finding out that as they enter 2014, even more conservative candidates will challenge them in party primaries. It's true for Republicans and Democrats, and that big challenge would come on the issue of health care reform.
Lots of criticism, lots of people complaining, but the people who it's actually working for, those people who are signing up, who are getting insurance, who are paying for it, who are going to be enrolled, I haven't heard too many people complain on that side, or am I just tone deaf to those people?
And they are the ones who stood with the president at his event yesterday, who will be with him at the economic speech today here with a public policy group called that was actually founded by a bunch of Democrats. You're going to see him repeatedly appear with people like Monica Weeks, the 26-year-old who introduced him yesterday. She has had a chronic disease, Crohn's disease, since she was in her late teens. Now that Obamacare has taken effect, she is working for a group. She can have her own insurance. She used to have transfusion that she said cost $15,000 per transfusion. She now is completely covered. She cannot be excluded because of a pre-existing condition. That was one happy customer.
Yeah, Ann Compton live at the White House for ABC News. Ann, thanks for spelling out all this for us. Have a good day, and we'll talk to you down the road.
You bet. Thanks, McGraw.
You got it. 7:28 here. She's the best. She's Ann Compton, and she's with us every time we need her live from the White House. Ann Compton.